Good morning, everyone. I hope everyone can hear me well. Um, uh, Thank you very much for the organizers of this event, and especially Dr. Jeff Silverstein, with whom I co-chair the Biosafety Level 4 Zoonotic Network. I have taken a look at the National Bio and Ag Defense Symposium. What a wonderful array of speakers that you have brought together, and what a wonderful agenda that you have built for this meeting. I cannot say how important this meeting is in terms of how it really is, because when we consider what has transpired in the last 1.5 years, I don't think any one of us actually imagined the world would be like it is today 2 years ago. While many of us have thought and planned and was always working in certain scientific fields, getting ready for such events, when it actually hit, I think it caught us surprised by the severity and the magnitude and the scope of the event. So in terms of the human health, in terms of the mental health impacts, in terms of the economic upheaval, the societal disruption, and the story is still being written, as we speak on this one. So this is why I think that the topic today and the symposia like this is absolutely critical. It is because if one thing that the world has realized through all this pandemic, it is that the research on infectious diseases and on biodefense, it matters. It matters because that actually offers our best hope in combating fast changing operating environment that we live in. The viruses, the transboundary in nature, zoonotics, in terms of catastrophic animal diseases, these are continuously emerging and changing. If we look at it in terms of what we are up against, in terms of the human-animal interactions that are continuously occurring and changing, the viruses that are changing and the other pathogens actually are changing their abilities, the pathogenesis and the host range. So and the species jumps that are happening, all that is to say, there's very little we can actually do to stop that evolutionary biology and that train in terms of that side of the equation. So the best insurance policy that we have against these fast changing array of pathogens lies in how well we actually invest in and do research and apply that knowledge in terms of coming up with countermeasures and enhancing our operational preparedness. So that is why the work that is being planned at the National Bio and Agriculture Defense Facility and many other laboratories like that who are around the world who are doing this work is actually absolutely critical in terms of enhancing our preparedness against this the very um, difficult and a fast changing array of pathogens. The nature of this work and the scope of this work is also very important. While it will have significant national scope, given the transboundary nature of these diseases, it essentially has to be national and international in scope. And it is also in terms of, it's not only the natural incursions of disease that we are worried about, we are also worried about the malicious intent, the deliberate manipulation of pathogens and their introduction, and it is the to bring about maximum damage from people who want to harm us. So our defenses against that in terms of whether it is a natural infection, incursion, or whether it is a deliberate introduction of a disease remains the how well we actually invest and actually do research in terms of these areas, in terms of you have included next generation diagnostics, the different our ability to differentiate the pathogens from the naturally occurring and deliberate, and our ability to trace, our ability to react very very quickly. Many of the epidemiological studies have shown that the speed of action is the most important, one of the most important factors in being able to control diseases. Our risk intelligence, our workforce that is actually competent and know, and then the know-how in terms of working in high biocontainment laboratories, and all that is actually going to be very, very critical. So one of the examples I want to share with you today is Biosafety Level 4 network, which I mentioned that Dr. Jeff Silverstein and I co-chair currently. Dr. Steve Kappas, whom you know very, very well from Agriculture Research Service, was the first co-chair of the BSL4C net. It is an organization with 5 countries: Canada, United States, Australia, UK, and Germany. It brings together top-notch laboratories from in animal health and in public health from the 5 countries. About 17 organizations are currently in it. We built the network over the last 4 years, and have brought it to a trusted partnership where we can freely exchange information. We have been working on 4 pillars, international response being one of them. We want training, scientific excellence, and being some of the other areas that we have worked in. So when the pandemic hit, it was actually quite easy for us to reach out to each other and say, look, let's meet on a weekly basis and let's exchange what we know about this virus. So it actually ended up being about 20 such meetings that we had, and it was absolutely critical in the beginning of the pandemic to get, and all of us were kind of blindsided by it. We didn't know a whole lot about it, and even the people knew we need to get access to very very quickly get access to them. So it so happened that many of the studies that the people started, the initial knowledge into about how to grow the virus, to in terms of the early animal susceptibility studies, the survival of the virus on different surfaces, all that information actually became well available to the network members well before any of them got into the preprints and publications or whatever. So it was really, really helpful in terms of how the community actually responded. And then similar to this meeting, this symposia, we also ran a symposium in August, September last year to try and share the knowledge as quickly as possible. So it actually is in terms of that international and national and international cooperation and collaboration is actually one of the critical pillars in terms of how successful we are going to be in dealing with the catastrophic animal diseases and human diseases of the future. So with all that, all I want to say is we have really appreciated the help of USDA, ARS, and APHIS, and other organizations in the United States and in other countries in working together in advancing our thought processes, our preparedness, because our best insurance policy, as I said, remains in enhancing our preparedness and actually putting good effort into developing the mitigation measures and countermeasures. So the topic today that you're tackling, and I've taken a look at the agenda, excellent agenda, with number of speakers today talking about the next generation vaccines. with African swine fever and with foot and mouth, Nipah and Hendra. So excellent array of presentations coming up. I want to congratulate the organizers for bringing such a very good array of speakers together in this conference. And also I noticed that there are several speakers from the BSL-4 ZNet laboratories as well. So all that is to say, I think it is going to be a very exciting day and a very exciting symposium in terms of sharing knowledge. With that, I want to stop and in thanking again Jeff and all the organizers of this meeting. And I will now turn this over to Dr. Jerry for moderating this meeting. Thank you.